Assalamualaikum and salam sejahtera, Doctor. We are from Group 7 want to do a presentation about UTHM student perception of the effectiveness of MySejahtera application usage in daily life. This is our group member.
So I would like to present introduction. From a various perspective, COVID-19 has a significant impact on Malaysia. To resolve this issue, the government created the MySejahtera application, which was developed by the Ministry of Health in collaboration with the National Security Council, the Malaysian Administrative Modernization and Management Planning Unit, and the Ministry of Science, Technology and Innovation. So, the main purpose of the software, MySejahtera, is to identify close contact between COVID-19 patients using MySejahtera check-in feature. MySejahtera may determine the risk status of COVID-19 illness through a self-height evaluation and allow users to track the COVID-19 hotspot zone through hotspot tracker. Particularly, if there are positive instances within a 1 kilometer radius of their GPS guide position. Then, the Ministry of Health used MySejahtera to communicate any new announcement and information regarding COVID-19 as well as health clinic that perform COVID-19 screening tests depending on their present location. Moreover, the National Security Council and other agencies have access to the application built by KPI Soft Sdn in terms of corporate social responsibility to be utilized at the national level to track the COVID-19 epidemic progress. Literature review. According to previous study, the ongoing COVID-19 epidemic has highlighted the need for mobile app solution to limit the danger of cross-contamination induced by close contact. Mobile apps such as MySejahtera are easily available, acceptable, and adopted, and they can help with social separations. Apps enable healthcare practitioner to make decisions more quickly and with less mistake.
Now, I'm going to explain about our research methodology for research design. We gather data using quantitative method by conducting online surveying or questionnaire in the Google form. The data were analyzed by using SPSS to determine UTHM student perception on the effectiveness of MySejahtera application usage in daily life. Meanwhile, the descriptive result was reported as frequency and percentage. Pie chart and table have been presented to show the data. For data collection, our studies have 4 sections, which is A, B, C and D. All respondents are compulsory to answer it. The first section is about demography. The question is about their personal information, such as their gender, faculty, year of study and others. Next, section B is about the usage of MySejahtera application. Section C, the respondent need to answer all the questions about the acceptance of MySejahtera application, while the section D is about challenges in using MySejahtera application. In sample size, the targeted respondents are 20, which is they are a student from UTHM that were selected randomly from first year to fourth year. Now, I'm going to explain about our analysis demography in our study. According to the table 1, the highest gender of respondent is female with 75% and frequency of 15. Meanwhile, male falls in the minor gender of respondent with 25% and frequency of 5. As you can see at the table above, it can be stated that the nationality of 20 respondents is overall Malaysian with 100% at frequency of 20. It shown that most of the respondents are live and born in Malaysia. Based on the table and pie chart, the highest number of respondents by faculty is FPTP. The percentage is 65% and the frequency is 13. FPTP respondents are higher because mostly of our respondents are friends each other from the same faculty. Next, the lowest number of faculty respondents is FCUP and FPTV with a similar percentage of 2.5% and a frequency of 1, while the second list is FPTV and FKMP, which is 10% with 2 frequencies respectively, and the least respondent in the study recorded was FCUP, FKEE, and FSKTA, which only 1 frequencies with 5%. From the table, it depicts that the highest number of respondents by year of study is in year 3. The percentage is 75% and the frequency is 15. It is because the survey was conducted by students of year 3. Besides, the lowest number of respondents by year of study is in year 1, 2, and 3 with 10%, which is 2 frequency, and 5%, 1 respectively. Table 4 shows that all the respondents have their own smartphone, with 100% since the smartphones are widely used by our society to communicate and stay connected nowadays. Not only that, the smartphone also very needed to all users in order to find some information, especially regarding of COVID-19. From the table and pie chart, it shown that percentage of respondents installed MySejahtera application in their phone recorded as 100%, which is it was being mandatory for all Malaysians to install this health COVID-19 tracking apps. It is because this application is very important nowadays to record and track COVID-19 around us. According to the table and pie chart, it shows that all Malaysians are very frequent to use MySejahtera application in their dailies, with 15 of frequency at 70%, while the rest is 13% at 6 of frequency. It can be stated that MySejahtera application is necessary since we need to scan and check in wherever we go in order to trace COVID-19 around us, which is it has become a new norm and mandatory nowadays. That's all from me, Nurul Fatihah binti Soimi, AP 190160. Now I'm passing to my friends to explain further.
Assalamualaikum and hello everyone. My name is Nurul Fakria, number metric AP 200069. Today we'll be present the usage of application MySejahtera. First of all, we give a statement for respondent to respond. And the first statement is you always check in and check out with MySejahtera apps when going to anywhere. And the largest number of respondents is agree and very agree with 8 over 20 respondents equal to 40%. And the list is not agree and natural, which is consists of 2 respondents equal to 10% of all. This is because it become a routine, as our Senior Minister Datuk Seri Ismail Sabri said check in and check out with MySejahtera is compulsory when going to premise. Next statement is you always update your MySejahtera app's profile status by answering the COVID-19 status question to know your current risk level. From the table and pie chart, we can see that many respondents answer agree and neutral for this statement, which take around 40% of 100% consists of 8 people. Meanwhile, the list is very agree and not agree collected 2 respondents each equally to 10%. By using MySejahtera apps, help Malaysia health government to monitor users' health and can take fast action. The third one is to show your digital certificate to responsible parties when at public places or inside premise. Most of the respondents respond as agree to this statement with 60% and 12 respondents. Meanwhile, only 2 respondents choose neutral with 10%. As we can see from Faizah Tonggon and Dodge Novakovic right in 2021 about vaccine is only give mild side effect, so digital certificate helps to investigate who didn't take vaccine. For next statement, we ask respondent about the MySejahtera can trace the COVID-19 cases near my location. So from the table, we can see that the respondent about 8 people equal to 40% very agree with this statement, while the list is neutral answer only 2 people which equal to 10%. The comment from Datuk Dr. Nur Hisham Abdullah about the hotspot tracker is intended to assist the public in planning their commute and avoiding non-essential travel. The last one from my part is about is it the respondent always up to date with number of COVID-19 cases in Malaysia? So most of the respondents respond agree and very agree, which is 8 people each and equal to 40%. But the least number of respondents is 1 people respond not agree, which equal to 5%. This is happened because MySejahtera can help people to feel convenience updating the number of new cases every day, as help people monitor update of COVID-19 in Malaysia.
Assalamualaikum and hi, my name is Nur Alia Natasha binti Azman. My metric number is AP190479. Now, I will explain about Section C, which is the acceptance of the MySejahtera application. The first statement is, I feel comfortable when using MySejahtera application. From the diagram, we can see very agree has the highest percentage of respondent for this statement, which is 50% or equal to 10 respondent. Then, neutral have the lowest percentage of respondent for this statement, which is 5% or equal to 1 respondent only. The reason is users feel comfortable because they believe that their personal data have been protected and will remain confidential. Other than that, government have a guarantee that all the information will only be used to track and prevent COVID-19 cases during this epidemic in this country. The second statement is the MySejahtera application is user-friendly for everyone. From this statement, we can see that very agree and agree have the highest percentage of respondent for this statement, which is 45% or equal to 9 respondent. While for neutral, it has the lowest percentage of respondent for this statement, which is 10% or equal to 2 respondent only. It is because MySejahtera application is suitable to be used by all age, especially for seniors. The user interface of the application has been designed with a proper arrangement. Other than that, the apps were updated with a new features that can display the risk level and vaccination status easily and not consume a lot of time when we want to enter in premise. The third statement is the MySejahtera application can trace the COVID-19 cases near my location. From the diagram, we can see that Agree has the highest percentage of respondent for this statement, which is 50% or equal to 10 respondent, while for the lowest percentage of respondent in this statement is neutral, which is 10% or equal to 2 respondent only. Many people can accept MySejahtera application because people will easily know whether they have contact with those infected people nearby or not, and can know how many people was infected in that area. For the fourth statement is, I always scan the MySejahtera application when I go to mall, office, restaurant or other public place. From the diagram, we can see that Very Agree has the highest percentage of respondent for this statement, which is 55% or equal to 11 respondent. While for the lowest percentage of respondent for this statement is neutral, which is 1% or equal to 5 respondent only. During this new norm, people need to scan their MySejahtera application before entering any premise, mall, office or others, because it was compulsory to follow the SOP that has been regulated by the government. For the last statement in this section is, I feel easy to update my profile about my health condition, especially when I am in quarantine. Based on the diagram, the Very Agree has the highest percentage of respondent for this statement, which is 55% or equal to 11 respondent, while for the lowest is neutral, which is 50% or equal to 3 respondent only. Nowadays, COVID-19 patients can do quarantine at their own house, so they need to update their profile, especially when there has a symptom that was cured. Since it was easy to use, many people can update their health status at any time.
My name is Priyadarshini Kanmatu, AP190209 from Management Information System Group 7. I'm going to present about Section D, the challenges in using MySejahtera application. From the pie chart is about I feel unsafe and uncomfortable when all my movement can be tracked using the MySejahtera application. The highest number of respondents who disagree with the statement is 30%. The lowest respondents who agree with the statement are 10%. The highest respondents disagree because they believe that the MySejahtera application is safe to use since the data in the MySejahtera app is safeguarded by the Personal Data Protection Act of 2010. According to the pie chart, is about after leaving the store, I always forget to click checkout in the MySejahtera application. The highest number of respondents who really agree with the statement is 45%, and the lowest percentage, 10%, is recorded for those respondents who disagree and neutral. The highest respondent majority agree with the statement because many of us have failed to check out on the MySejahtera app while leaving a building. According to the pie chart, is about I feel the need to use the MySejahtera application as a new norm. The highest number of respondents who agree with the statement is 45%, and the lowest number of respondents who disagree with the statement is 5%. The highest respondent agreed because the tracking application has been implemented for a while, where the citizens of the Malaysia were already used to the new norm. The pie chart is about not everyone efforts to buy a phone since the MySejahtera application is compulsory by the government. The highest number of respondents who agree with the statement is 45%, and the lowest is respondent who neutral with the statement is 10%. Thus, the highest respondent agreed with the statement because the government's insistence on using the MySejahtera app as the go-to app for all COVID-related matters had left many members of society, particularly senior citizens and B40 families who are either not tech-savvy or do not own a smartphone. Based on the pie chart is about the MySejahtera application is sometimes not working and always lag when scanning the QR code. The highest are respondents who agree and very agree with the statement with the same 35%. The lowest is respondents who disagree with the statement is 10%. The respondent majority agree, which is recorded as the highest percentage because some users say that the app will stop responding once opened on their smart devices, preventing further interaction.
Good morning, my name is Tan Jun Wei. I'm from Group 7. My metric number is AP190389. Today, I want to present about the conclusion. In this report, the Ministry of Health faces considerable challenges in closely tracking the relationship of COVID-19 patients. The objective of our group report is challenges, acceptance, and use of MySejahtera in the daily life among UTHM students. For Section B, there are two statements that have majority respondents will agree, which is you always check in and check out with MySejahtera apps when going to any place, and to show your digital certificate to responsible parties when at the public place or inside the premise. For Section C, there are two statements that have majority respondents will agree, which is I feel comfortable when using the MySejahtera application and I always scan the MySejahtera application when I go to mall, restaurants, office, and other public places. For the last section, Section D, there are the challenges in using MySejahtera application. The majority of respondents at 17 out 20, which is 95%, agreed the statement I feel the need to use the MySejahtera application as a new norm. Thank you.
Recommendation. The first recommendation in MySejahtera application is improve the security level of MySejahtera application. The problem of theft of vaccine certificate number often occur in the community due to poor security level. So to overcome this problem, the government must strive to increase a high level of security so that user information is not easy to be leaked and accessed by irresponsible people. The second recommendation to improve the MySejahtera application home screen design. To gain popularity with the MySejahtera app, the home screen must be simple, clear, and simple to use. The third recommendation is MySejahtera application need to increase more language in the application. Now, MySejahtera application is only available in two type of language, which is in English and Malay. Developer can add on other language such as Chinese, Japanese, and other that can help other users that do not understand well in Malay or English language have another language to understand. The fourth recommendation is notification design purpose need to add in MySejahtera application. Developer can create a notification page to inform users some information or remind users to update the application when the latest version has been released. The lastly recommendation is improve MySejahtera management system. This is because delay on the app for the user status become an obstacle from them to go any place. So the developer need to improve the management system of the apps to avoid which delay which can cause problem to other. Thank you.